Yeah, thanks to Carmen for the slides. Now, my idea for this presentation is to give a very brief introduction on the International Federation for Spina Bifida and Hydrocephalus, and to talk a little bit more uh, about the mandate that we have and the role that I see for us and for our member organizations. And then later on today, Anna and Carmen will talk specifically about two aspects of this mandate. One on fortification, that will be Anna, and the other one on the World Spina Bifida and Hydrocephalus Day, and that will be Carmen. And thank you for setting this up. I know it's a bit challenging, so if you don't hear me very well, can you just write a message? I'm at the European conference, at the European Commission's event right now, and it's a bit challenging to find a quiet spot and to find a spot with a good internet access. So apologies for that. So the International Federation for Spina Bifida and Hydrocephalus is a membership organization, a global membership organization, and we have about 60 members in about 60 countries. You can see it on the map here. We do have contacts with a lot more Spina Bifida and Hydrocephalus associations that are not necessarily members.
The slides are on again. Sorry to interrupt. It's just
what happened?
The slides are not showing. It's like you're not the presenter anymore. Yeah, you are the presenter, but it's not showing.
Am I on the right account? The presenter? I am there. Yeah.
It was visible before. I don't know what changed. There it is again.
Yeah, I was so I logged in with my phone for the audio, and the slides are on my computer. So I logged in with two devices. So it has to be on the right device. As I said, it is challenging, so apologies for that. So the mission of the International Federation is to have to work towards a better quality of life of persons with spina bifida and hydrocephalus, and to work on primary prevention of these disabilities. And in order to do this work, we have an international mandate. So we work with the United Nations and its agencies, such as the WHO, but also with the European Commission. So currently, I'm at the Disability High-Level Group organized for the EU member states here at the European Commission. And I think it is important for people with spina bifida and hydrocephalus to be represented through their representative organizations in this type of meetings. Our focus the last couple of years has been on data, not only data for in the sense of incidence of spina bifida and hydrocephalus, but also working on data that will register the quality of life of persons with spina bifida and hydrocephalus throughout the lifespan. So, for example, currently we are working with a network of European clinicians to develop a clinical network for spina bifida and hydrocephalus in Europe, and measuring the health outcomes of people affected with the disabilities is an important aspect of that work. I'm not saying it's easy. I'm not saying it is ready. I'm saying it's a focus. Incidence measurements, for example, are also really important for the work on both prevention and access to healthcare. It will allow for better policy on prevention, and I think Anna might touch on this subject later on during this seminar. If there is no good view on the real incidence of spina bifida, it's very hard to define programs to do primary prevention of these of spina bifida. And this is a global problem. I mean, we have limited data. I mean, in Europe it's better, but Europe is an affluent region, but in the rest of the world it's really, really scarce. And if we do an incidence study, there is a very high incidence of spina bifida and hydrocephalus, triggering us to raise awareness and to adopt policy to put more efforts in the primary prevention. Another a second focus area is the right to health. So people with spina bifida and hydrocephalus have a complex disability that requires a multidisciplinary approach for medical aspects of their life, but also for social or social inclusion or inclusive education. It's a very broad spectrum, but we focus currently on the right to health. And the reason is that colleagues of ours focus on other aspects of the life of persons with disabilities. For example, the current discussion in this meeting that I'm attending is the Accessibility Act for the European Union. And EDF is the European Disability Forum, is very active in this area and representing us very well. But there are very few organizations that work on a global scale advocating for the rights of persons with disabilities and their access to health. There is very limited capacity and there is very limited awareness on this topic. So we focus on the right to health. And in Europe, again, it's much better, but in other regions of the world, there is, for example, an enormous lack of neurosurgical care. So there is a lot of work in this area. And then the third focus area is that we try to network both with spina bifida and hydrocephalus associations, but also broader with other institutions and agencies and organizations that work towards the same goals that we try to achieve. Now I'm trying to move my slides because that's what I said before. We need to approach spina bifida and hydrocephalus multidisciplinary, not only in the care or in prevention, but in all aspects of life. And spina bifida and hydrocephalus associations have a representative mandate for this work, and that's our role. We represent people with spina bifida and hydrocephalus when it's about people with spina bifida and hydrocephalus. That is the mandate entrusted to IF and its members and other spina bifida and hydrocephalus associations when it is about spina bifida and hydrocephalus. Initially, most organizations start out as parents organizations because this is a child born with a disability, but they move and the longer spina bifida and hydrocephalus associations exist, the more people with the disability themselves become advocates and become leaders in their associations. And in order to raise awareness and to improve advocacy, we, together with our members, decided on the General Assembly of 2011 to start the World Spina Bifida and Hydrocephalus Day as a moment in the year to come out of our sometimes small little spina bifida and hydrocephalus bubble and to share stories of people living with the disabilities with the outer world to make it more visible, to fight against the often very negative stereotypical thinking when it comes to spina bifida and hydrocephalus. When it comes to disabilities that children are born with, there is a lot of stigma around these disabilities, and this stigma is an inhibitor for good policy, for good care. It leads to isolation and it leads to preventable human suffering. So the World Spina Bifida and Hydrocephalus Day is an instrument to overcome this, to fight against this stigma and this discrimination. And I hope we can show this in, for example, the campaign that Carmen will present later during this seminar. That's all for my very brief introduction. So I would thank you for the opportunity to involve IF in your activities, and wish you a happy World Spina Bifida and Hydrocephalus.